BSI PPE. First thing I'm going to do is check my fluids. I'm going to ensure that they're the proper fluid, they're in expiration date, and they're clear. After that, I'm going to make sure I've selected the SAM IO. Just inspecting all of it, making sure it's good. Then I'm going to go ahead and prepare my fluids via administration set, inspecting all that. I've selected a 20 drop set. I'm going to go ahead and take my bag off, hold it upside down, take off, and then spike my bag. I'm going to make sure that's closed so we don't leak everywhere. Hang that back up, flip that over, fill up my drip set to about halfway. Then I'm going to go ahead and hang this to keep it from getting contaminated while we're doing other stuff. Actually, before I do that, I'm just going to go ahead and flush it so I don't have to remember to later. All right, line is flushed. Then I'm going to go ahead, take my syringe, open it up, get my flush ready. I'm going to keep this bag though, because the inside of it is sterile. Go ahead and open this up, pop the seal on it. I'm going to attach it to my clean extension set. Take the caps off of everything, so I'm not fumbling to do that when I've got a needle. Go ahead and flush, that's good. I'm going to take this, put the end of that inside of my flush bag, so now I can lay that down and not worry about it. Okay, now I'm going to tear my tape. Okay, now that I've teared my tape, I'm going to locate the site by going proximal tibia, going one finger down, one finger over. I've identified my site. I'm now keeping a finger there because I have a habit of losing my sight. I am now going to wipe aseptic technique away. Get my finger below the site directly so I know where it is. I'm now going to stabilize with my left hand, avoiding going under where I'm going to be puncturing, making sure I'm where I'm supposed to be. Well, before I stabilize, I'm going to go ahead and attach my needle. Okay, now I'm going to stabilize, avoiding underneath where I'm going to be. Now I've got stabilization. Going to take cap off of my needle, come in at the right angle, push down till I meet resistance. I'm going to drill till I get a pass through. There it was. All right. Now I'm going to release the leg and take control of it directly. Disconnect my IO. I'm then going to pull out my catheter, or my stylus, not the catheter. There it goes. I'm going to dispose of it in my sharps container. I'm then going to take my clean extension set. I'm going to attach it to my IO port while maintaining control. I'm going to aspirate, looking for bone marrow to make sure we're where we're supposed to be. Now that I've aspirated, I'm going to go ahead and push my flush into the syringe into the needle looking for signs of infiltration. I don't see any, so I'm going to take this off, keeping this clean and keeping secure on my IO. I'm going to go ahead and attach my IV fluids. Maintaining secure. I'm going to go ahead, make sure my line's open and patent. Now that I see that it is, I have no problem securing my IV or my IO down with some bulky dressing and this extra tape that I tore in the beginning. Under, right there. And we're going to tape this all the way around. All right, then I'm done.